Good afternoon, everybody. We're just going to give it a few more minutes for a few more people who are coming through. Thank you for being all here. Great. Okay. Okay, right. Well, I think we'll begin. And good afternoon, everybody, and a very warm welcome to today's Let's Talk Health webinar. My name is Charlotte Miller. I'm the director of Intergenerational Music Making, co-founder of Intergenerational England, and I'm also a clinical paediatric NHS music therapist. On the call today is also Emily Abbott, who's also the co-founder of Intergenerational England and programme director of Intergenerational Music Making. So it's a real privilege to be chairing today's discussion, especially during Global Intergenerational Week, which is an international moment dedicated to celebrating and strengthening connections across generations. This is the second webinar in our Intergenerational England Let's Talk series. Yesterday we explored everything around housing, and today we turn our focus to health, which is a very vital and timely topic. So before we start, just a little brief introduction about Intergenerational England, just for those whom don't know us, who aren't aware of who we are. We're a national not-for-profit organisation dedicated to embedding intergenerational approaches across policy, practice and communities. And through strategic advocacy, research and partnership working, we're very much championing the power of connecting generations to tackle societal changes, from loneliness and mental health inequalities to workforce gaps and age segregation. Our work focuses on 4 key areas: so advocacy, strategic support, research, innovation and collaborative networks. Today, we are delighted to be joined by such an amazing and exceptional panel. We have Dr. Priya Kumar here, GP partner, population health management and health inequalities lead at the Kumar Medical Centre in Slough. Dr. Priya has been a practicing GP since 2013, and she's known for her leadership in population health management, digital health innovation, and addressing health disparities. She's also held several roles within Slough and Frimley ICB, including primary care strategy lead, urgent care lead, and health inequalities lead. And her clinical leadership has been pivotal actually in addressing health inequalities through initiatives that she'll be talking about today, like the Multi-Generational Household Project and the Wider Determinants of Health questionnaire. We're also thrilled to have George MacGinnis on the webinar with us today, Healthy Ageing Challenge Director at Innovate UK. And George leads Innovate UK's Healthy Lives programme, fostering innovations that enable people to live longer, healthier lives. And George's extensive background includes steering the UKRI Healthy Ageing Challenge and advising on health innovation strategy and championing digital inclusion in health. And last but not least is Marlene Krasovitsky. I hope I pronounced that right, Marlene. Apologies if I didn't. But representing the World Health Organization, and she's currently consulting to the World Health Organization's global campaign to combat ageism. Marlene is also consulting with Help Age International to map ageism initiatives globally, with a particular focus in low and middle income countries. So today's format, it's going to be a very relaxed affair, a panel discussion followed by audience Q&A. And so please do post your questions in the chat function throughout the event. And just a gentle reminder that today's session is going to be recorded and we will circulate it afterwards. So before we start with the discussions, we are talking today about health, and I just want to say a tiny bit about how we're framing it. So we're framing it holistically, encompassing not only the physical health, but also mental, emotional, and social well-being across the life course. Health is not simply the absence of disease, it's the ability really to live with purpose, connection, and dignity, but at every stage of life. An intergenerational approach strengthens health outcomes by fostering community belonging, reducing loneliness, enhancing preventative care, and building resilience across systems. And we know that the challenges facing our health system, there's rising inequalities, an aging population, youth mental health pressures, cannot be solved by siloed approaches. So intergenerational solutions are interdisciplinary, they're integrated and intersectional, offering a very powerful framework for addressing these complex issues in a more connected and sustainable way. So we're going to start with the discussions, and I'd first like to invite Dr. Priya. It's an absolute pleasure to have you with us here today. And the first question we have for yourself, it'd be wonderful if you are able to kindly share with those here today a little more about the multi-generational household project in Slough, as it really has been pivotal in addressing health inequalities, and then perhaps mention a little more about how intergenerational approaches really have contributed to tackling public health challenges, such as, whether loneliness, mental health issues, and access to preventative care. Thank you, Priya.
Thank you, Charlotte, and thanks for having me here today. It's an absolute honour. So yes, in Slough, we did the multi-generational household visits. The programme really started in March 2023, where we looked at the data and identified households that weren't visiting primary care. So on a population health basis, we tried to understand who wasn't engaging with primary care in the traditional way of just coming to the surgery. And what we noticed is that there were specific families, from the immunisations of the children to the NHS health checkups for the parents, the checkups for the grandparents. And there's about 13.9% of Slough's population lives in a multi-generational household. So what we decided to do was actually do outreach visits where we would visit the whole family. A health team would they do the immunisations, would do the NHS health checkups for the parents and the diabetic checkup for the grandparents. A particular family I went to visit, we actually cornered the husband, the 39-year-old, who hadn't come to our surgery in 2.5 years for his pre-diabetic checkup, by accessing the house through the immunisation for the child. So it was really interesting, and that peer support element. Cancer screening was really interesting, being able to talk about all the different types of cancer screening for a family. So from breast screening to cervical screening to bowel screening, and actually all the other different members of the family hearing about all the different types of screening. And what we did in Slough is we actually did that across all the practices in Slough. There were 441 households that were visited, and we had about a 45% increase in public health indicators, which was quite significant. And since the programme has actually stopped, that has significantly dropped back to its original baseline, where we did have poor outcomes in Slough. We have 150 different languages spoken, 10-year life expectancy compared to the next town. So this outreach really, really supported our families in a really different way. It also, lots of people think that they live in a multi-generational household and there's not loneliness. But the really interesting thing is you can live in a large household and still feel pretty lonely. So we would leave leaflets about urgent care, mental health, cancer screening, and then we had more people come up and talk to us in our practice, back at the practice, with regards to mental health. Another thing which was really interesting is I went out to see a 50-year-old lady who had about 11 children in the household. Children that were grandchildren, but also her own children, overcrowding, and it was absolutely fascinating. She didn't speak English, and we went in and did all the immunisations for the children. Again, an outreach immunisation for the 1-year-old. We did all the flu for the other children that had asthma in the household. There was damp in the house, so going into the household was really interesting as well. But she hadn't had her breast or cervical screening, so we had the conversation there and then with her children where her children could translate in their own language. And she actually got her breast screening and cervical screening done because she couldn't get her 7 children on the bus to come and do her immunizations. We went out and sorted that out for her, and it was a new trusted relationship. And we talked about social prescribing. But obviously what we're talking about is multi-generational households on individual family basis, but we wanted to take that to another level. We wanted to bring these families to actually together. So our really exciting project that we just literally launched last week was the Wexham Wellbeing Hub, which has been strategically positioned between 3 schools and 1 nursery. And we're giving wellbeing classes there, and we're doing it in conjunction with Viva Slough, with the schools, with the immunisation teams, the screening teams. We're also inviting Healthier Together, that does NHS health checkups. We have outside speakers coming to talk to all these all these families that are attending the actual hub. And what was really interesting, to our surprise, 120 people turned up. And my colleague from Viva Slough, Amandeep, asked me, what have we done differently this time for such a community to turn up? I said, we collaborated across sectors to bring all these generations. We had the schools involved, we had the surgeries involved, we had the voluntary sector involved, we had the Slough Borough Council involved, the immunisation team also invited people. And actually, really oddly enough, we started the class, we usually do a talk and then an exercise class, which is for free. And they asked, why is the childhood immunisation team here when the majority of people here are grandparents at the moment? There were parents and there were a few children there. And I said, because they're really influential in the household. So if they know how important immunizations are, and we can educate the grandparents in the house, potentially we could educate the parents that encourage them to go and get their immunizations. So it's really exciting. It's breaking social barriers. It's creating new comms plans. So we put the actual class in the school newsletter before Easter. So actually the parents, the grandparents reading the newsletter could actually understand where the class was. It was close from pickup. All these little things we can change to outreach to people we don't normally get to is really important. Talking to our communities to understand what we need to do next. Thank you.
Thank you, Priya, for such a kind of a powerful example of how taking that kind of multi-generational, intergenerational approach has increased access to care. It's tackling health inequalities, but at that community level, and how looking at the population health data and working with the community, how you've able to reach so many and have such a huge impact through that intergenerational framework. So thank you so much. Absolutely brilliant case study. Thank you. And I think building on that idea of prevention and integration, it'd be great to bring George into the conversation next. And George, the question I pose to you really is, how do you see intergenerational work aligning with the government's broader health mission? What are the opportunities for innovation in this space, with its focus particularly on prevention, integration and tackling health inequalities? It'd be great to get your thoughts, George. Thank you.
Yeah, so it's a really big question, and maybe just before I start, to sort of help sort of frame some of my own thinking that's drawn from experience, and I'm really struck by what Priya's just said, because one level, I'm from Innovate UK, the government's innovation agency, part of UK research and innovation, budget of several billion a year, with partner organizations like the Medical Research Council, etc. So how do you go from this really practical, this is what really takes to affect people, to being at a high level at the government and funding things and that you want to trickle down and have an effect? And when you introduced me, you sort of introduced me as sort of Challenge Director for Healthy Aging. That's a program that ran for 5 years, just finished. It's interesting. So Healthy Aging, we were about almost everything but the NHS aspects of aging. And so often we think of aging older people in particular, being the high intensity users of health and care services, etc. And actually, one of the things we find is that when you focus on something like that and then think, well, actually, how do you put the healthy in there? How do you put the prevention? You find it's actually before people start needing the services, not after. So you start raising these questions about, well, when does healthy aging start or finish? And for many people, it actually starts in the womb, and goes on from there. So we have that sort of scope problem. I think the other thing, which is really interesting, what Priya was saying, is that when we actually looked at where you can affect things, again, it wasn't necessarily the health service that we were looking at first, although there were components that it was outdoor places and town design. It was employment. Employment, actually as an opportunity to improve financial well-being as well as the physical, mental, and social well-being bits that you mentioned, Charlotte. That lack of financial well-being, a reason why all generations sometimes feel really isolated and unable to do things. And then there were the more usual things, whether it's dealing with cognitive impairment, often typically the solution sits on family, or with assistive technologies, hearing aids, glasses, but more complicated ones as well, helping people to remain a part of life. And I think that has really shaped my thinking that actually we've got to think really holistically. And it's quite interesting when you do that. Another organization that's sort of emerged at the same sort of time as we were working on that is a business coalition called Business for Health. And again, it's looking at how do employers actually look after their own populations, but what's the role of their products and services in the health of the nation? What's their role as anchor organizations in organizations? And when you get onto that, again, it's really interesting. Maybe in a Trumpian era, diversity and inclusion is sort of being pushed aside. But, I think the case for diverse workforces has been there for a long time. But I think age diversity is one that actually has been underemphasized. And if you look at some of the great thinkers in this space, like Andrew Scott, about what does it mean to live longer and all the rest of it, you suddenly realize that actually employment isn't just going up a greasy pole. There must be other ways of doing that. And I think that's bringing brand new opportunities to bring generations together and learn from each other. So that's the sort of background that I came from. And you asked me specifically about the government's health mission. On the face of it, the mission was an NHS fit for the future. And they defined three main goals: timely access to high quality healthcare, fewer lives lost to the biggest killer, and a fairer Britain where everyone lives well for longer, etc. And that forces you to think about the health system. But actually, those of us that have been knocking around the health system go back to some of that experience I just was saying. It's actually about the health and care system. And it's then also about housing and all sorts of other things associated with care. So you can't fix the NHS without actually thinking about all these broader aspects. How do I bring that back into intergenerational? Again, really interesting. I think we create problems when we other groups of people and we isolate them because we cut off the value that they can create and just see need. And I'll give you some. I mean, there's some obvious well-known examples. The care homes that now run nurseries, the sort of the arrangements that some universities are having for students to live in with older people, as a deeper form of befriending and thing. So they're there, but actually they're quite limited. Stop and think for a minute. What's the future of our towns with the death of retail? And actually, what if we made them spaces where the generations mixed more, and looked for something else rather than just shopping? And you begin to get some real sense. And then I went up to Manchester, to an area where they had what they called a naturally occurring retirement community. Basically, the young people had left, or the younger people had grown old in place. And they did a lot of work on what did they really want from their community. And one of the things was actually just making the neighborhood more walkable for people who are old. And that related to actually strategically placing park benches so that people could go to the local shop and actually stop off and take a rest on the way back home, as opposed to calling to a taxi and going to the out-of-town shopping centre. So you begin to get to know the local things. In a strange coincidence, I also did some work about 20 years ago on community policing. And at that time, they were looking at benches and phone boxes as vectors for youth disorder. So I asked the old people, don't you get disorder, around the park benches? She said, oh, no. Actually, when I'm sat there, the young people come and sit and chat with me. An example of social control, but also the benefits of actually beginning to mix generations coming forward. So you asked about the broader health mission, and really I'm just making the case that this can't just be about medical innovation and fixing the NHS. It's got to be something that's much wider. I think maybe that's enough to leave it like that, and that will open a conversation. But clearly the NHS has a role. I'm delighted Priya's already mentioned social prescribing, because there's so much about the wider things that are not formal healthcare that will come into that. And I'll hand back to you, Charlotte.
Oh, thank you, George, and thank you so much for your contribution there. It was really clear, in what you're saying, that innovation and prevention, it must go kind of hand in hand with this holistic approach, like you mentioned, if we are to build, a fairer and healthier future. And also touching on your point around really that need to create, I wrote it down, more intentional intergenerational spaces like the hubs, that Priya has talked about, is really vital. And also that sectorial approach, absolutely. I mean, here at Intergenerational England, we couldn't agree more with that. Working intergenerationally naturally works across the intersection of, people, ages, communities, races, and sectors. And actually, like you say, we have to consider and bring into those conversations. If we're today already talking about health, but absolutely, we need to think and consider housing, workforce, culture, youth, education, all of those. So absolutely incredible comments, and and taking that life course approach that we've all talked about. So thank you, George, there. I'm now going to sort of widen our lens to the global stage, and I'm delighted to turn to Marlene from the World Health Organization. Thank you so much, for joining us and being part of these conversations, Marlene. From a WHO perspective, it'd be great to think with, what role do intergenerational initiatives play in the decade of, healthy aging agenda, and how can they be leveraged to improve global health outcomes? So thank you for your contributions.
Thank you, Charlotte, and thank you again for the invitation to be with you today. There are so many threads that I'm just dying to dive into that Priya and George have raised, but I'll try and answer your question. So combating ageism is one of the 4 pillars of the Decade of Healthy Aging, which runs from 2021 to 2030, along with age-friendly cities and communities, and some of that's the good stuff that George was just talking about, but also there's long-term care and integrated care. And during the decade, the WHO is also addressing social isolation and loneliness as one of the themes that cuts across those 4 main action areas of the Decade of Healthy Aging. But unlike the other 3 pillars of the decade, combating ageism is not time limited. So we don't expect to have done that by 2030, in recognition of the fact that it takes time to change deeply embedded social norms. And here we're talking about the way we think, act, and feel towards aging and older people. The Decade of Healthy Aging is all about transforming the world to be a better place to grow older. And we recognise that longer lives are one of humanity's greatest achievements, but we don't want to just add years to our lives. We want to enjoy good health and well-being in later life. And this means changing our attitudes, environments, and systems, much of which we've started to talk about. So this is definitely an ambitious agenda, and it's supported by a broad collaboration across diverse sectors and stakeholders. But what does combating ageism have to do with health or indeed intergenerational approaches? Let me step out my very simple 3-point argument, which is, firstly, ageism is bad for our health. Secondly, social isolation and loneliness are bad for our health. And thirdly, intergenerational approaches, when done well, are good for our health. So let me elaborate a little bit. Ageism is bad for our health. Ageism is the stereotyping, the way we think, prejudices, the way we feel, and discrimination, the way we act towards others or oneself based solely on age. And ageism has serious, far-reaching consequences for people's health, well-being, and human rights. According to the first global report on ageism for older people, ageism is associated with shorter lifespan, poorer physical and mental health, slower recovery, cognitive decline. Ageism reduces older people's quality of life, increases social isolation and loneliness, and may increase the risks of violence and abuse. Now, internalized or self-directed ageism can lead to acceptance of illness as an inevitable part of getting older, and may also be related to not participating in health-promoting activities, such as screening or diabetes management. And it also can contribute to inappropriate medication use, inappropriate prescribing, and poorly coordinated care. So secondly, social isolation and loneliness are bad for our health. Now, loneliness refers to the discrepancy between the social connections that you have and those that you want, both in terms of quantity and quality. So yes, you may have a full social diary with many engagements, but they may not be very satisfying, and you may not experience the intimacy or the friendship that you're seeking, or you may not feel valued or respected in those relationships. And sometimes those diaries are dictated more by obligation than by personal choice. Now, loneliness and social isolation have significant impacts on mortality and health. For example, social isolation and loneliness increase the risk of early death, and poor physical health, and there are many examples there, but also poor mental health like anxiety and depression. There is power in social connection, and this is where intergenerational approaches shine. So to the third plank of my argument, intergenerational approaches are good for our health. Intergenerational practice is one of 3 strategies that have proven to work in reducing ageism, along with policy and law and educational intervention. The science tells us that the evidence-based outcomes of quality intergenerational projects on ageism lead to improved self-esteem, confidence and worth, less depression, reduced social isolation and loneliness, less anxiety, better memory, and so on and so on. Intergenerational practice, of course, brings people of different ages or generations together in purposeful, mutually beneficial activities that promote greater understanding and respect. It is inclusive, building on the positive resources that younger and older people have to offer each other and those around them. So working to address ageism, reduce social isolation and loneliness, and building evidence-based intergenerational approaches can improve global health outcomes.
Yeah, absolutely. And incredibly powerful, all of that. And I wrote down your in quotes, intergenerational approaches are good for our health. I mean, that's such a, that is the statement. And it's really inspiring to hear how solidarity between generations is being prioritized, but on an international scale actually, and taken forward. And you talked about there, putting emphasis on the power in social connection and the place and the important place that intergenerational approaches have in that, and the role that it has in that. So absolutely wonderful to hear. And I think we all agree in terms of changing the attitudes, the environment, the systems. There's also more, we can go on to this in our discussion, but also a place, and it came up yesterday in one of the conversations around, language and education, and how we talk about this intergenerational approach as well. So there might be some more scope to have to kind of unpick that a little bit more. Yesterday we were at, and I know you were there, of course, at the launch of the new WHO Ageism scale. And I just wondered if you were able just to kind of share your thoughts on that scale, on how this measurement, can help us really sort of tackle ageism within the healthcare system, but also how, you have talked about it, how intergenerational approaches are contributing to it. But it would be great to get your thoughts about the scale. Yes.
Absolutely. Yes, we were fortunate last night for me in Australia, but yesterday for most other people, to launch the first ageism scale, which is, in my mind and in many others' minds, a game changer, because we all know that evidence matters. And the one thing we are trying to encourage is more evaluation of intergenerational programs, but also other interventions more broadly. So before I get to the scale, can I just talk quickly about another publication that we have, which is called Connecting Generations, which builds on the critical importance of intergenerational work to combat ageism. And Connecting Generations is a publication you'll find at our website, which is A World for All Ages. And it provides practical step-by-step guidance for anyone who is using or wishes to use intergenerational practice to combat ageism and to promote understanding and mutual respect among generations. And we all know, whilst intergenerational practice is invaluable in reducing ageism, it also brings many, many other wider benefits. But the publication Connecting Generations includes a number of foundational principles on how to design practices so they are evidence-based, so they are inclusive, participatory, equitable, uphold rights, and so on. And there are lots of case studies from all over the world in Connecting Generations, and there are many activities that are outlined. And I'm sure that for those of you who haven't had a chance to browse it, you will find it an inspiring read. Now, in terms of the launch of the scale last night, we have just launched this ageism scale, which is a highly flexible and easy to use scale to measure ageism and its impact. So this is a breakthrough in opportunities that we now have to measure the impact of our intergenerational programs or whatever initiative that we're undertaking on ageist stereotypes, prejudices, and discrimination. So this particular tool focuses on the 3 dimensions of ageism, as I said before, stereotypes, prejudices, and discrimination, but also at the various levels that it plays out: interpersonal, internalised or self-directed, and institutional. There are 15 items in the scale, and they're sort of divided up amongst those levels and those types of ageism. It's a very, very simple tool. And it was developed because the first global report on ageism highlighted the lack of evidence in terms of prevalence, determinants, impacts, interventions, which could then therefore inform strategy, policy, and so on. There were some tools that were out there, but for various reasons, the WHO decided that actually it needed to develop a new tool in keeping with its approach and definitions of ageism and what the research and evidence base told us that we needed. And when I say it's a flexible tool, it's been tested and coupled with in diverse contexts such as refugee status, flood survivors, age-friendly cities and communities, social determinants of health, and impacts on cognition of older people. So they are very, very diverse contexts. And the goal of the scale is to provide accurate and comparable measures of ageism to better illuminate the causes and the consequences of ageism for individuals and societies, and as I said, therefore to inform policies and interventions. This is a critical tool now that we have to build our evidence base. There is a user guide and a manual on the website. It can be used alongside your broader intervention or program to measure impacts and change, and it will give you the evidence that can then take you to the next level. So I do commend it to you. You'll find it at hashtag a world for all ages. It's got its own webpage, and it is available in 10 languages now. The plan is to have more available. You don't need permission to use it, so please do have a browse and incorporate it into your interventions, your research, whatever context works for you.
Thank you, Marlene. Thank you. And we'll put the link in the chat as well. Yeah. And the webinar is now from last night is also now public. So for those that haven't seen it, but no, it's a fabulous scale, and very much look forward to using it. So thank you very much for shining some light on that. Now, if we're going to move into kind of thinking around the opportunities and challenges, Priya and George, it'd be great for you to have a think and contribute around this question, which is focusing really on kind of partnerships. And so we kind of wanted to sort of pose to you, how can partnerships across sectors be strengthened to embed intergenerational practices into the UK's health agenda, but also, what challenges might we face in this integration? It'd be great, George or Priya, to get your thoughts on that. Who would like to go?
I was first going to say, George, next week at the Hub, it's all about social prescribing, believe it or not. So we're going with the work well, as well as the housing. They're coming down to talk to all the residents. I totally agree with the wider determinants of health, and I kind of just going back on what George and Marlene have said to that question. I guess it's policy alignment, isn't it? We've all got different policies, and how do we put it as a thread with intergenerational approaches? And even though we've come together as a leadership group, to be honest, there are multiple leaders as part of this Wexham Hub. we need to have that strategic leadership alignment at the top for it to be embedded at scale. And I think that's what George was saying. There are pockets of these innovations across the country, but how do we go from pockets of innovation to business as usual? So that policy alignment and that strategic leadership is really important, but obviously funding. So at the moment, the way the Wexham Hub is working, Spine PCN, which I'm part of, 242 and Kumar Medical Centre and Spine are funding part of it. And then Viva Slough is bringing part of the funding with the classes. So at the moment, we're just doing it within our own funding pots. But imagine if that funding pot was pooled. And how do we start to get integrated funding pots for projects like this, where actually it's not, I'm taking a little bit of mine. And it's great because we've just come together as a group and we've done a bit of innovation, brought our leadership together. But for it to be mainstream, it needs to be pooled funding as well in that sort of way. Sharing training and workforce and more importantly, our community. It still has to be community driven. It's one of the most important things sometimes. Once the buzz starts going and things start to happen, you start to make decisions, but let's take it a step back, let the community make the decisions and really let's start to bring them at the forefront of those decisions. And finally, which is always where I go to, is data. So it's the data that we have, but it's also the data we don't have. There is a lot of hidden data, qualitative data, which we get from the faith leaders, the VCSC. This is the street you need to go to. This is the house. You know, we've noticed that they're not turning up to the church or the mosque or the Hindu temple. And that qualitative data is the most important, I actually think, because we can find the people in the data where we need to find them, outreach in different ways through all our strategic partners, but it's that qualitative data which I think that adds the final lens of that wider determinants of health. And then we have common metrics. At the moment, all our metrics are different. So therefore, we all have different goals and targets, and we're all trying to fulfill a goal and target of our own institution. But how do we get to a point where we have pooled budgets, a pooled goal for the population? And we start working together in a different way because those pillars, as I would say, are in place for us to make that change.
Yeah, thank you, Priya. And absolutely, I think, you know, budgets and funding are always one. It's always one that comes up. But your thoughts around, certainly, you know, you touched on that kind of bottom up, top down approach and thinking about the partnership working and integration on all levels, whether it's from like you talk about, you know, the makeup of the hub and inviting citizen advice, social prescribers, you know, the GPs are there, you know, that kind of intersection of partnerships, but also looking on another level, looking at health and wellbeing boards as well, looking at the ICS boards and actually who sits on those tables and who are sitting within those conversations. And we have seen some ICSs and some health and wellbeing boards already shifting to more of a integrated approach as well, which is wonderful to see. I mean, Dr. Claire Fuller is one of our trustees at Intergenerational England, and sort of working very closely with the ICSs and thinking around the NHS 10-year plan now and what will come out in June, but hopefully a place within that there will be that intergenerational lens within it. So yeah, thinking on all those levels actually, yeah, and how we can then mitigate those challenges. George, I wondered if you had any thoughts, reflections.
Beg your pardon, I was on mute for a minute. Well, I think my introduction sort of said that actually this is pulled together by so many different sectors. So partnerships need to be, you know, front and central to delivery, because it's the same as I was making the point about othering generations. Othering services just means that people sort of fail to sort of think through the synergies that they could get by working differently. I was minded that, you know, up in Blackpool, they addressed deaths through overdose by a different approach with the policing. And actually they found, you know, one of the things they found was most of the deaths occurred within a few months of being released from prison, where the sort of people had lost their tolerance for the drugs, went back on their old dose, and killed. And so there was a combination of tough love from police, tough love from the prison, the prison reform system, and from the health service together, and they actually tackled that problem and achieved some really great results. Another example of thinking differently, we funded a project in Wales, really interesting, where the Housing Association was rethinking the role of the housing warden and giving them a much greater role in identifying and addressing social isolation. And they were working with a big tech company over some tech for that. But fundamental to it was actually getting people on the ground working differently, and just the sort of way that Priya's talked about, going into homes, multi-generational homes, and doing things. So I think there are lots of opportunities. One of the things that we experimented with was, again, thinking about this bottom up rather than the sort of top down innovation. We started funding social ventures, but specifically existing social ventures, helping them to think about what would it do to scale and go beyond the sort of founder entrepreneur basis of where they are. And I think we've had some really good success like that. And one of our projects was Active Families Northeast, who some very motivated people getting older people active in that particular case. They realized they weren't going to be able to do it themselves, and they've eventually settled on a sort of franchising model for how they would do that. The challenges, some of them are really big government challenges. There was a really interesting piece, thought piece. I can't remember where I read it. It was somewhere like The Economist or something. It came up on our newsflash about, government divides money into sort of capital expenditure and year-on-year revenue expenditure, but actually should there be a separate budget for prevention expenditure, which might be a mixture of those two, but specifically saying we talk about it all the time, we're just not getting there, to ring fence that and do that. I think another bit about getting people talking the same language is working with the same populations. I think integrated care systems, integrated care boards and partnerships and all the rest of it work best when they talk the same language. I'm minded that Essex County Council has 3 integrated care boards it has to work with, all with different priorities. Some of them actually, Essex is only part of where they're dealing with. So how do you, unless you can come up with the same language and same priorities, it's very, very difficult to do partnership working. And I think my third question actually comes back to something that we've mentioned, social prescribing. I firmly believe that there's real opportunity here, but not as a completely free good to the health service. That most things that are socially prescribed require facilitators, organising, insurance, sometimes facilities. They're not just there for free. And, if it is about freeing up the prescribed drug budget and things, demand on hospitals, there has to be some recognition that actually it's not just about funding what one person called the travel agents, the navigators who can send you to something. You've actually got to think about funding the end service. So there's both an opportunity and a challenge involved in that piece.
Yeah, absolutely. I couldn't agree more. And some really interesting points there, around, like you mentioned, talking the same language and aligning, those priorities, and also the opportunity with social prescribing, absolutely, and coming back to that funding challenge as well. We very much see it with some of the funding, the intergenerational funding. It's very siloed in regards, the funding either sits with the older sector or the younger CYP, or it sits with, X, Y, and Z, and actually there isn't that overarching intergenerational fund, and that's a challenge and maybe something, and also an opportunity that we could collectively work on. Yes.
But I mean, before COVID, the sort of Leisure and Gyms Association did some really interesting work on gym use, and at that point they found that older people were the fastest growing, most sort of faithful sort of members of their associations, and they were active at times when the gyms were typically otherwise not busy. So there was a real opportunity for local authorities to think about that. Now, COVID actually probably pushed that back a decade in terms of some of those sorts of people, but it's not all a problem, if you like. There are real opportunities to tap into these things, and I really liked what Marlene was sort of saying about challenging ageism, because that's another example of challenging the perception old people don't want to go to gyms, or old people don't want to be trained by someone who's younger and fitter, or things like that. I think there's a lot in that sort of piece. I suppose it's the prejudice piece, isn't it? Those inbuilt prejudices that prevent people from accessing all that's available.
Yeah, absolutely. Thank you, George. And Marlene, I wondered if you wanted to just reflect on George's comments, or if you had any thoughts.
Look, I think that ageism is a real barrier to aging well, and it is a barrier to participation. It is other people's attitudes towards us as older people, and as you say, George, their expectations or their low expectations of us, without even bothering to ask us what our views are. But also just it can also come from inside. It can be my own sense of worth that perhaps resources are better spent somewhere else on the younger people. Perhaps I've had my time. Perhaps I feel devalued, and so I will hold myself back, if you like. So it can take many forms, but it is a barrier to aging well. It is a barrier to participation. It is a barrier to connection. And with that comes a whole range of other health-related issues. But there is also one other element that I would like to talk about for a moment when we talk about opportunities, again, coming from the international institution perspective. I do want to acknowledge that across the United Nations, there is a growing discourse and action to strengthen intergenerational solidarity as a way of building a world for all ages. For example, there was a Summit of the Future last year in September, and the concept of intergenerational solidarity was an essential cornerstone of those discussions. And the UN's Decade of Healthy Aging was a contributor to that discourse as well. But something we've seen more recently this year is that promoting intergenerational solidarity and combating ageism and eradicating age discrimination are increasingly being partnered as strategies to realise the society for all ages. For example, these were the first two action points of a recent UN report called Intergenerational Relations, Creating a World for All Ages so that no one is left behind. And that was authored by the 5 regional commissions that are part of the Economic and Social Council of the UN. So that's Africa, Europe, Latin America and the Caribbean, Asia and the Pacific, and Western Asia. So I do think there are opportunities. I do think that there is a growing discourse, and we're all familiar with intergenerational approaches around the arts, bringing older and younger people together for various projects or storytelling or community projects and so on. But what I'm seeing more of at the international level is using intergenerational approaches to address some of the most pressing issues of our time, like health inequities, like digital divides, like climate change, and so on. So I think there's an opportunity here that we can all start to gather together and amplify.
Yeah, absolutely, Marlene. And I think we've got so much learning to do, and we can look, across the waters to see where it's shifting and the platform that it's on, and the importance, and that particularly the United Nations and how they're leading it forward, and that's the shift that we need to make here as well, really. So thank you very much. I'm aware of the time. It's nearly come to the end of this webinar. I wondered if there were any questions from anybody here today, or if anyone has any questions. We will be sharing this afterwards, and we'll also share the links to those papers and research and articles that have been mentioned as well, so people can follow up on it. But if you do have any questions, please do put them in the chat. I wondered if Priya or George or Marlene, if you had any burning final contributions or thoughts or moments, words of inspiration around this topic you'd like to share. Priya?
I would say intergenerational approaches is all about generational change. And I know that's a chicken and egg, but it literally is, and we haven't achieved it for years. And I agree with George and Marlene. It's not just about health; it is about those wider determinants of health. What's happening in your family? What's happening in your community? How do we galvanise that approach across the generations to create a change? And I'm just excited to see where this next year goes.
Wonderful. Thank you, Priya. Thank you very much.
George? No, I think that's what Priya said is really inspiring, and it makes me think of Charlotte, your event last week where Bobby Duffy was speaking in terms of actually there is a sort of renewal aspect of the next generations actually not just being the same as the previous ones, but actually learning and adapting and being different. And I think we see some aspects of this. I actually see some aspects of this through things like social media already, that people interact in different ways across generations. And I think the more that we can encourage that, the better. And I think as well, although technology has a role, place is going to be really where this matters, and making it relevant in everyday lives.
Yeah.
And for me, these kinds of conversations make me incredibly optimistic, and the creativity and the holistic approaches that I've heard in this session just buoy me with a sense of, as I say, optimism. And that big creative thinking of breaking down the silos, the barriers. I look forward to all of those approaches, building a world for all ages where all of our human rights are upheld, and it's based on inclusion and respect and participation.
Yeah, absolutely. Oh, well, thank you so much to our wonderful panelists today, for it really was such a rich and insightful and inspiring, discussion. So thank you so much. I think, we've heard clearly how the intergenerational approach can not only enhance mental and physical health, but also strengthen, prevention, equity, and community resilience. So the key real pillars for building a healthier and fairer society. This is the second in our series. We do have more Let's Talk webinars coming up over the next few months. So please, do join us. And thank you so much for being here with us all today to celebrate Global Intergenerational Week. We'll fully, here at Intergenerational England and also at Intergenerational Music Making, encourage everyone really to continue this intergenerational conversation, this intergenerational momentum. And thank you very much for your support. So thank you to George, thank you, Marlene, and thank you, Priya, for a wonderful conversation today. And let's keep talking intergenerational health. Wonderful.
Let's keep talking.
Thank you.
Yeah, good.
Thank
Thanks.
you. All the
Thanks
best.
so
Bye-bye.
much. Thank you. Bye.